You're listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. You're listening to the Your Knee, Your Health podcast, and I'm Dr. Adam Rosen. Today's going to be a fairly brief episode, but I just want to give you my 2 cents on stem cells and other biologic treatments for knee arthritis because this is an extremely common question that I get from many of the patients that I take care of. Now, just understand that stem cells are an incredible cell, and it is true that from a stem cell you can essentially make any type of cell in the body. I strongly encourage you to do your research, look at reputable organizations. I would refer you to our association, what's called AAHKS. The abbreviation stands for the American Association of Hip and Knee Surgeons. And their position statement currently is, and I quote, our position is that biologics, including stem cells and PRP, cannot currently be recommended for the treatment of hip and knee arthritis, end quote. And I ask you to really do that research prior to spending money because I've had many of my patients come in and say that they've spent upwards of $5,000, $8,000, or $10,000 on numerous treatments. Now, the brief story that I explain to patients is that, yes, a stem cell can become any cell, but let's take, for example, if I have a gentleman who's balding or bald. Now, if we take stem cells from his fat or bone marrow and then take that and pour it on his head, would you expect those stem cells to then decide to turn into hair cells and sprout out of the top of his scalp? Yeah, most people would chuckle and laugh because there's no way that that would happen. And this is all the while where you go home and put your baseball hat on and wash your hair and wash your scalp and dry it and sleep on your pillow. Now, the same sort of analogy really holds true to an arthritic knee. So if you have an arthritic knee, what you're essentially expecting to happen is that someone's going to take stem cells from your fat or your bone marrow, and that they're then going to inject them inside your knee. And that stem cell is going to decide to become a cartilage cell, not a hair cell, not a bone cell, not a heart cell, not a liver cell, but a cartilage cell. And it's only going to attach itself and grow where you're missing cartilage. There's really no way for it to dissolve bone spurs. There's no way to stop that cartilage cell from attaching to the ligaments and other structures inside your knee. And this is all the while that you're walking, bending, straightening, and doing all your daily activities. So yes, stem cells have the potential to become a cartilage cell. And I know extremely intelligent individuals and scientists and doctors that are working on this and can take a stem cell in a laboratory setting and create a cartilage cell. But at this point, we do not have the means to then inject that into the knee to treat knee arthritis. So I just have you really question the provider that is offering this treatment to you and really do your research. I've always been a believer that for most treatments, that if it's not harmful and you see benefit and it's affordable, that they're reasonable things to try. And this falls more into the supplement game and the brace realm and topical agents and things like that. But when we get into invasive injectables that are extremely expensive, we're talking sometimes 5 to 8 times what a surgeon would get paid to do a knee replacement procedure, you really have to question as to whether or not this is a safe and efficacious treatment for your knee arthritis or whether or not you should try other options first and avoid this until we have more research and more data. But I do believe at one point in the future we may have an excellent way with biologics to create cartilage and treat arthritic knees, but currently the science is lacking. So I hope that answers some of your questions. You've been listening to the Your Knee, Your Health podcast. Until next time, I'm Dr. Adam Rosen. Thanks for listening. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.